Hello everyone, this is Dr. Ruchi Shrotkar. I'm going to talk about the second part of constipation in children. In the first part, we talk about the five most important medicines for constipation in children. In this part, we'll be also talking about another five important remedies for constipation in children. And we'll be also giving some tips related to constipation in children. So I'll be starting with the sixth medicine because the first five we have already discussed earlier. So the sixth medicine would be sulfur. What are the indications of sulfur? In sulfur children, the stools are really large. So it is difficult to pass the stool. It will cause a lot of pain, right? And so the child develops a fear that the child does not want to pass the stool. So the child would avoid going to the washroom. They will hold on to their stools. Why? Because passing stools is painful for the child. And when you observe the anal orifice, they will have redness of anal orifices. Rest of the characteristics can also be there, like hot child and the typical past history of skin infections or something like that. But the main indication is large impacted stools, which causes a lot of pain, and the child develops a lot of fear to pass the stool, right? The sixth medicine that I'm going to talk about is Sanicula. So, what are the indications of Sanicula? I always write this for Sanicula: irritable child, hot child, profuse perspiration, especially feet. Parents say it seems as if he has washed his feet. So much it perspires. So, irritable, hot, perspiration, tendency to dandruff. There'll be dandruff of the eyebrows also. And the stools are very, very sticky. So, they stick to the anus, right? So, I had a patient where the mother complained that we have to use a high high pressure jet spray to wash off the stools. It's so sticky. She even said that if the child is moving about, the stools will stick to the bum and will not fall down. That kind of stickiness is very characteristic of Sanicula. And Sanicula will also hold the pot seat while straining at stools, right? The sorry, eighth remedy that I'm going to talk about is silicea. Silicea, we all know that they have stool which recede. So a child would say, when I go to the washroom, I feel the pressure, I feel that the stool is coming out and it goes back. This typical presentation is of silicea, associated with chilliness and timidity and bashful and stage fright is silica. Now, the ninth medicine is Aloes. Aloes I have given to some children with constipation. What is typical of Aloes? A typical sentence that I always see in my clinic is the child is constipated, not able to pass the stool, and but the parents say that he soils his clothes. So involuntary stools. This perfect combination of constipation, straining, not able to pass the stool, but at times there are involuntary stools in the pants. This perfect combination, I have used it many times, and then you wonder why the child has involuntary stools with constipation, but this happens. So this perfect combination is Alos. And the 10th remedy that I'm going to talk about is Magmure. Magmure, stools crumble at the verge of anus. So, what do you mean by stool crumble at the verge of anus? That the child feels that the potty is coming, and when the stools are at the anus, they'll be, they will break down into pieces. To make it very comfortable for you to understand, they would be into small, small balls, like a sheep dung. They do small, small balls like this, and a characteristic aggravation from milk, right? So, this is magnesia. So these are another five medicines that we talked about: sulfur, sanicula, silicea, and aloes and magmure. Another five medicines which I use very, very frequently in constipation. Now, some important tips related to constipation in children. Constipation after a disease. So the parents would say, oh, he was all fine, he had regular stools, but he had a fall, and after that he started having constipation, or he had a viral infection, or he had a septic throat infection, and then he had constipation. So if the child has a septic infection, a septic fever, a septic focus, and then the child started having constipation, think of pyrogen. Always give an intercurrent remedy, pyrogen, and followed by your constitutional medicine. Second, if the child has an injury, a fall, and then the child started having constipation, think of arnica or ruta as an intercurrent medicine. Constipation after an operation, I have given opium with an excellent result, क्योंकि उसमें they give injections, anesthesia, and after that the peristaltic movements of the intestine gets affected. So we should think of opium. Constipation with clean tongue. Today only I prescribed absolutely clean tongue with constipation, and some of the child had craving salt, and rest of the features are also present, right? So I had given to that child natural mule, right? Another thing, constipation, and the parents would complain कि इसके मुंह से बहुत smell आती है, offensive breath associated with constipation in children. There are three medicines: carbolic acid, surinam, and I think one more medicine, I think opium, yeah. So carbolic acid, opium, and surinam. Offensive breath with constipation. Constipation है बच्चे को, and after some time the child also has retention of urine. The urine, while passing urine also he's facing difficulty. The medicine is cannabis sativa. So I have tried to cover major remedies for constipation, and also some important tips that I'm talking about. I think this video will be helpful. Try studying remedies from clinical points of view also, and from the rubrics point of view also. So when we study remedy incomplete, like how will we use this remedy therapeutically, or how will we use this remedy from mind, we have a more clearer and a broader picture of the remedy. I hope this video will help you, and I'll keep posting the video, and keep studying, keep learning. Thank you very much.